Oxygen therapy is a medical treatment used to supply O2 to patients who have trouble getting the right amount of oxygen to their tissues. Oxygen enters the body via the nose and mouth and travels through the airways into the lungs, through the bronchi, bronchioles, and alveoli, where it diffuses into the bloodstream. Pulmonary veins transport O2 to the heart, and the heart pumps it through the arteries to the organs and tissues. Without oxygen, the tissues can become hypoxemic, which can lead to a number of issues. Oxygen therapy can be used in acute and chronic cases. Long-term oxygen therapy improves survival, exercise capacity, cognitive performance, and sleep in hypoxemic patients. Goals for oxygen therapy are to keep the oxygen saturation greater than 90% during rest, sleep, and exertion, or to keep the partial pressure of O2 in the blood greater than 60 millimeters mercury, reducing the workload on the heart. Arterial blood gas tests and pulse oximetry are two tests that measure oxygen levels in the blood. O2 is considered a medicine, so your doctor must prescribe it. Oxygen is usually administered to treat hypoxemia caused by respiratory disorders like COPD, pulmonary hypertension, pneumonia, atelectasis, and for cardiovascular disorders such as myocardial infarction, dysrhythmias, angina pectoris, and for central nervous system disorders such as an overdose of opioids, head injury, and sleep disorders. There are various oxygen devices for different circumstances. Today we meet a patient, Andrew, admitted to the hospital with one such illness, and our student nurse, Josh, will have to decide what the most appropriate device will be for our patient. Now you have to pay close attention because Josh will need your help to make this decision.
Good morning, Andrew.
Good morning.
Tell me a little bit about what brought you in here today.
Well, I'm a little bit short of breath, and it gets worse when I do things. And I have this cough that I can't seem to get rid of. And it's bringing up a lot of secretions and things like that. And there's like a wheezing noise that's happening sometimes when I breathe.
All right. Are you a smoker by any chance?
Yes, I am.
How much do you smoke?
A pack a day.
Okay, and how long have you been smoking?
About 10 years.
All right. Looking at your chart here, it looks like the doctor's initial diagnosis is COPD exacerbation. COPD, or chronic obstructive pulmonary disease, refers to a group of lung disorders that can obstruct the airway or make it difficult to breathe. When listening to your lungs, I noticed that your breath sounds are a little quieter than we'd like. Your pulse oximeter reading, or how much oxygen percentage you're getting to all your tissues, is a little low, around 85%, and you have excess CO2. So the doctor's probably going to want to put you on some sort of oxygen therapy. I wonder, what kind of oxygen therapy would the doctor prescribe?
Hi Josh, I am option number 1, the nasal cannula. So, the nasal cannula is one of the most frequently used devices, and the great thing about it is it allows a lot of freedoms that a lot of the other oxygen devices do not give, such as being able to eat or talk while the device is on. What happens is the tubing is connected to a flow meter, and the flow meter is connected to an oxygen delivery, and the nasal prongs are actually the ones that deliver the oxygen. It is inserted into the nares, goes around the ears, and is secured under the chin. This is considered a low flow device because it offers 24% at 1 liter up to 44% at 6 liters per minute. If you're giving more than 35 to 40% oxygen, then you don't want to use the nasal cannula. The nasal cannula is used to give a little bit of an oxygen boost. So if the patient has a pulse ox of a little bit less than 95%. It is also really good to be used for long-term oxygen therapy.
There are some nursing considerations when administering O2 via nasal cannula. If the order is for a flow rate above 5 liters per minute, it is important to use a humidifier because it could prevent the patient from having dry mucous membranes, which could be very irritating. Also, patients with COPD can tolerate about 2 liters per minute but if the order is anything above that, then you might want to question it. Patients with COPD become dependent on a state of hypercapnia and hypoxia to stimulate the breathing reflex. So if the patient receives too much O2, then it could decrease or stop the patient's breathing reflexes. Also, as a nurse, you always want to assess the patient's response to therapy and also adjust the flow rate if needed. You might also want to assess the patient's nares and the patient's ears just to see if there's any skin breakdown, because for older patients, their skin is thinner and more fragile, so they're more susceptible to breakdowns.
Hi, Josh. So the second option is simple face mask. It is a low flow delivery device that delivers oxygen concentrations of 35 to 50% at flow rates of 6 to 12 liters per minute. It should not be used for flow rates less than 6 liters per minute to avoid and prevent free breathing of carbon dioxide. It is used for short-term therapy, such as when transporting the patients. It consists of plastic face mask that fits snugly on top of the nose and the mouth, and the elastic strap that goes over the head. It has tubing that connects to the oxygen source. As a nurse, you should wash and dry the mask every 2 hours. Watch for pressure necrosis, and in order to prevent it, consider using padding. You should also switch it to the nasal cannula when the patient is eating, and also consider humidification to prevent the nasal mucosas from drying.
Hi Josh, I'm option number 3, the non-rebreather mask. It is a low-flow delivery device used for short-term 24-hour therapy for patients requiring a higher oxygen concentration of 60 to 90% at 10 to 15 liters per minute. Oxygen flows into the reservoir bag and mask during inhalation. The bag allows the patient to rebreathe about the first third of exhaled air, which is rich in oxygen, in conjunction with flowing oxygen. Before you put the mask on the patient, you want to make sure that the oxygen flow rate is sufficient to keep the bag from collapsing. This prevents buildup of carbon dioxide in the bag. The mask also has a one-way valve that closes during exhalation and opens during inhalation to ensure that a high oxygen concentration is being delivered. When putting the mask on the patient, you want to make sure that the mask fits snugly on the nose and mouth. And you want to monitor the patient closely because intubation may be the next required intervention. If deflation occurs, you can always increase the oxygen flow rate to keep the bag inflated.
Hi Josh, I am option number 4, and this is the Venturi mask. So this right here is the Venturi mask, and this is the Venturi barrels, also known as entrapment devices, and these are also the other attachments. The Venturi device is a lightweight, plastic, cone-shaped, form-fitting mask. It fits on just like this onto the patient. The great thing is that it delivers a precise O2 flow in a variety of rates. So it depends on your entrapment device. So if, for instance, you want to start at a 24, you'll use a certain color. And if you want to go up all the way to a 50, use a different color. So it can be either a low rate or a high rate. And it's also, you have an adapter that you can put on for increased humidification for the patient's comfort. It's a short-term therapy used in the hospital setting. It's especially helpful for patients with COPD because it gives you a constant low flow rate of oxygen. And it's also indicated for patients who have carbon dioxide retention. Some nursing considerations, like other masks, you're supposed to clean it and remove it every 2 hours. Also, it's uncomfortable for the patient, so make sure when the patient is eating that you take it off and you put a nasal cannula instead. Also, you're going to want to watch the pressure around the ears. During prolonged usage, it can cause necrosis. And that is the Venturi mask.
Hi Josh, I am option number 5. This is the tracheostomy collar. And this is a high flow device, and it is secured on the neck of the patient with an elastic band. This can deliver high volumes of humidity and O2, and this can be attached to a ventilated device that can deliver exact amounts of O2s. The thing to look for with the tracheostomy collar is that O2 concentrations can be lost to the environment because the band is not secured tightly. Other things are that secretions can build up around the tube or the collar, so it has to be removed every 4 hours to be cleaned to prevent aspirations of fluid or infection. And condensation can and will occur in the tubing, so it must be drained distal to the tracheostomy tube.
Well, looking here, it looks like the doctors prescribed you a Venturi mask with 24% oxygen flow rate. Let's get that on. All right, how's that feel?
Feels pretty good.
We're going to make sure to assess your ears and nose for any skin breakdown. And don't worry, when you eat, we'll take off the mask and put on a nasal cannula. That way you have more comfort when you're eating. The biggest concerns we're going to worry about during this hospital stay is going to be ineffective airway clearance related to expiratory airflow obstruction, as evidenced by abnormal breath sounds, and impaired gas exchange related to alveolar hypoventilation, as evidenced by pulse oximetry less than 90% at rest.